What is estrogen? During puberty, the ovaries begin to secrete estrogen hormones each month through the menstrual cycle. In the middle of the menstrual cycle, estrogen levels rise sharply and an egg is released. The level of this hormone decreases rapidly after ovulation. Estrogens are a group of sex hormones that create and maintain female characteristics in the human body. These hormones cause the formation of secondary female characteristics such as the breasts, the regulation of the menstrual cycle, the reproductive system and their growth. An imbalance in the amount of estrogen in a woman's body leads to some diseases and physical changes. The ovaries are the main site of estrogen production. Estrogen causes structural differences between the bodies of men and women. For example, women have wider hips and longer hair. Synthetic estrogen has many medical uses, such as preventing pregnancy and controlling the effects of menopause. Estrogen promotes good health. Much less estrogen is also found in men. What factors increase or decrease estrogen? Reasons for low estrogen levels. Ovarian problems. Low activity of the pituitary gland. Problems in pregnancy. Menopause and premenopause. Polycystic ovary syndrome. Nervous anorexia. Heavy exercise. Use of some medications such as clomiphene. Giving birth. Breastfeeding. Reasons for increased estrogen levels. Maturity. Overweight and obesity. High blood pressure. Diabetes. Healthy pregnancy. Tumors of the ovary or adrenal gland. Some medications. Side effects of estrogen imbalance in the body. Decreased or stopped menstruation. Minor or severe bleeding during menstruation. Flushing. Night sweats or both. Development of non-cancerous glands in the breast or uterus. Mood swings and sleep problems. Excess weight, mostly in the buttocks, thighs and waist. Low sexual desire. Fatigue. Feeling depressed and anxious. Skin dryness. The function of estrogen in the body. Ovaries. Estrogen helps stimulate and grow egg follicles. Vagina. This hormone causes the vagina to grow and reach its proper size in adults, also thicken the vaginal wall. It also reduces bacterial infections by increasing vaginal acidity. At the same time, it helps to make the vaginal surface slippery. Fallopian tubes. Estrogen causes the muscle wall of the fallopian tubes to grow and thicken, providing the contractions needed to move eggs and sperm cells. Uterus. Estrogen improves and maintains the mucous membrane in the uterus. Increases endometrial size and improves blood flow, protein content and enzymatic activity. Estrogen also stimulates the muscles in the uterus and causes them to grow. During pregnancy, contractions in the uterus help push the baby out and the placenta, while at the same time during menstruation, they get rid of dead tissue caused by endometrial shedding in the uterus. Cervix. Estrogen regulates the flow of uterine mucus and the thickness of these mucosa. This condition increases the movement of sperm cells into the egg and fertilization. Mammary glands. Estrogen is responsible for the growth of the breasts during adolescence, the accumulation of pigments in the nipple, and finally the cessation of milk production when the baby is weaned. Effects of estrogen on the body. Brain. Estrogen can maintain body temperature, regulate the activity of the part of the brain involved in sexual development and increase the effects of good mood chemicals. Skin. Estrogen reduces the thickness of the skin and together with collagen prevents skin aging. Liver and heart. This hormone regulates the production of cholesterol in the liver and takes care of the heart and arteries. It makes women's body hair softer and less visible, but their scalp hair is more permanent and thicker. Estrogen makes the larynx smaller and the vocal cords shorter, making women have a softer voice than men. Estrogen reduces the activity of glands in the skin that produce oily and oily substances. This reduces the risk of acne in women. It makes the bones smaller and shorter, the pelvis wider and the shoulders narrower. It causes more fat to accumulate around the buttocks and thighs and gives the body more arches and curves. During puberty, it slows the growth of female characteristics and increases insulin sensitivity. Insulin affects the amount of fat and lean muscle in the body. Golden tips. Strawberries, walnuts, soy protein and sesame help produce and increase estrogen. In men, increased estrogen leads to gynecomastia, increased breast size, poor erection and infertility. Weight loss will be followed by estrogen deficiency in obese people. Because fat cells produce excess estrogen. Eating certain foods can lower the body's estrogen levels, such as figs, pomegranates and black grapes.